Today we'll discuss on PIH, by definition, chronic hypertension less than 22 weeks, PIH more than 22 weeks, mild more than 140 over 90, moderate more than 150 over 100, severe more than 160 over 110. Symptoms of impending eclampsia: severe headache and vomiting due to increased intracranial pressure, hyperreflexia or breeze reflex due to cerebral edema, edema due to acute kidney injury because of acute tubular necrosis due to the capillary rupture due to the high blood pressure, blurring of vision due to retinal detachment, epigastric pain due to liver subcapsular hemorrhage. Management of impending eclampsia: medication, oral antihypertensive. During the first trimester, we give alpha blocker, which is metodopa 1 gram TDS tablet. Second trimester, beta blocker, which is tablet labetalol 400 milligram TDS. It is medium acting, which is the mode of action at 30 minutes to 1 hour. Third trimester, we give CCB, which is tablet nifedipine 30 milligram TDS. This is fast acting. It acts about 15 to 30 minutes. There's high risk of hypotension causing placenta insufficiency. Besides oral antihypertensive, we must do CTG, ultrasound Doppler to assume the fetal survival days or hours and anticipate the prime baby. We must book the ventilator, give IM dexamethasone. But please check the glucometer first because there's high risk of hyperglycemia that can cause decay and intrauterine death. Eclampsia: when there's history of FIT, proteinuria, and PIH, we must know how to dilute the magnesium sulfate. The use of magnesium sulfate here is to prevent the FIT, to treat the FIT, and as a tocolytic agent plus neuroprotection for the preterm. However, when administering the magnesium sulfate, you must do MACSULF chart to monitor the toxicity and the sign of MACSULF toxicity are reduced in urine output. This will cause reduction in magnesium excretion this is not due to the toxicity, however this is due to the PIH. Normally the urine output 0.5 cc per kg per hour. Sign number 2 will be reducing deep tendon reflex. Deep tendon reflex includes the biceps, triceps, patella, Achilles. This reduction, deep tendon reflex, is the first sign of toxicity. The second sign of toxicity will be reduction in respiratory rate, breathing difficulty, and the third sign will be reduction in consciousness level. So how do you manage the toxicity? First, put CBD, strict IO chart, and IV drip for 150 cc to 200 cc for 1 hour. Of the magnesium sulfate, run 10 cc of IV calcium gluconate 10%. Alright, how do we dilute the magnesium sulfate? In one vial, there's 2.47 gram in 5 mils. So we have loading dose and maintenance dose. How to prepare the loading dose? The dilution, we take 2 vials, which is 10 cc. From there, we take 8 cc, thus becoming 4 gram, about 4 gram. And from that 8 cc, we add 12 cc of water for injection, and total will become 20 cc. And we set for 15 to 20 minutes. For loading dose, you must use the diluted magnesium sulfate. We give slow bolus IV Maxal 4 gram in 20 cc normal saline over 15 to 20 minutes. For maintenance, it must be non-diluted. IV Maxal 1 gram per hour. And how do we prep it? We no need water for dilution. Only take 10 vials, which contains 50 cc, and become about 24 gram. And you set for 1 gram per hour. Alright, in case of fit emergency, we give a parenteral medication, including IV hydralazine 5 mg bolus and IV labetalol 20 mg bolus. How do we prepare the IV hydralazine? In one vial, there's 1 ml equals to 20 mg. So we take 1 vial, add 9 cc of water, it becomes 10 cc. In that 10 cc there's 20 mg hydralazine. So from the 10 cc we take only 2.5 cc because you only want 5 mg. Okay, for IV labetalol 20 mg bolus, in 1 vial of labetalol there's 5 ml equals to 25 mg. So we take 1 vial, add 5 cc of water, it becomes 10 cc. In that 10 cc there's 25 mg. We take only 8 cc because we only want 20 mg. Alright, other than parenteral medication, we must do emergency cesarean section. Keep the patient for 5 days because there's high risk of fitting within 72 hours, and start on heparin for 10 days because the patient have high risk of embolism.